Hello friends, today I would like to discuss about the topic microcephaly, pediatric topic of growth. Microcephaly is nothing but a small head. The head circumference is below the 3 standard deviations, means head circumference more than 3 standard deviations below the normal mean for given age, sex and gestation. Means the head circumference is decreased more than 3 standard deviations. That is more than 3 standard deviations decrease. What are the causes of microcephaly? Important in microcephaly is what are the factors that is causing this microcephaly? One among the cause is isolated microcephaly. Isolated microcephaly is seen mainly due to autosomal conditions, autosomal recessive or a dominant. Autosomal recessive is more commonly seen among these conditions. It may be also X-linked conditions also seen associated with microcephaly. And some syndromes associated with what are the syndromes that are causing microcephaly is trisomy conditions. Trisomy 13, 18, 21. And some other syndromes associated are like Williams syndrome, Cry-Do chart, Seckel syndrome, etc. And what are the structural brain defects that are causing this microcephaly? These structural brain defects, I would like to classify it into two types, like neuronal migration disorders, migration defects, and neural tube defects. Among neuronal migration defects, it includes like lissencephaly, schizencephaly, polymicrogyria. Whereas neuronal defects, what is neural tube defects? Tube defects is nothing but anencephaly, hydranencephaly. What are the metabolic conditions which are causing this microcephaly? One most important metabolic causes of this microcephaly is nothing but phenylketonuria. What is the importance of this phenylketonuria? We all know that phenylketonuria occurs due to the deficiency of the enzyme phenylalanine hydroxylase. Phenylalanine hydroxylase. What happens when this phenylalanine hydroxylase enzyme is deficient? When this phenylalanine hydroxyl enzyme is deficient, then phenylalanine won't be converted into other forms. So phenylalanine will be accumulated. There is an accumulation of phenylalanine. So this phenylalanine is neurotoxic. So automatically neurotoxic means microcephaly will occur. What are the infections which are causing this microcephaly or torch infections? You remember torch infections. Torch infections, you know, T is toxoplasmosis, others means like HIV, syphilis, etc. Or is rubella. T is toxoplasmosis. And C is cytomegalovirus, H is herpes simplex virus. What are the teratogens that are causing microcephaly? We all know that alcohol, phenytoin, you remember these two conditions mainly. Drugs. When consumption of alcohol, it leads to fetal alcohol syndrome, fetal Hydantoin syndrome. and other teratogens like anti-epileptics and radiation exposure, etc. And what are this perinatal insult? Means when during prolonged delivery, it will result in the insult to the child. What is that condition which is causing this microcephaly due to prolonged birth is nothing but hypoxic ischemic encephalopathy. Hypoxic HIE, nothing but hypoxic ischemic encephalopathy. It results in this condition. Hypoxic ischemic encephalopathy results in microcephaly. What are the endocrinal disorders causing this microcephaly is nothing but hypothyroidism, hypopituitarism, etc. And how we will diagnose this condition of microcephaly? We will measure this head circumference. How we will measure this measurement of head circumference? By using tape from occiput to the supraorbital region, occipitofrontal circumference. Occipitofrontal circumference. It will be reduced than that of age. Then we can know this microcephaly is happening. More than 3 standard deviations below the mean means microcephaly. And again, in any other future association syndrome means it will be a group of diseases. We can see the group of signs and symptoms present. Then we can easily identify the causes of this microcephaly, and if any endocrinal causes, then the thyroxine test, TSH test, and hypopituitarism, and any teratogen exposure also we can ask in history, and any infections we can be easily detected by the rash, like that. History, main important is history. And during labor we can ask a history. During labor, any prolonged labor occurs, we can easily identify the microcephaly. And what is the treatment? Treatment is nothing but treat the cause. If we remove the cause, then in syndromes we are unable to achieve this efficient treatment. But if it is due to any hypothyroidism, this microcephaly is occurring, supplement this thyroid hormone like levothyroxine, then head will grow. And phenylketonuria, this enzyme supplementation of phenylalanine hydroxylase, like that. Any infections, treat that infections, like that we can treat this condition of microcephaly. Thank you.